And it's time now for our health segment, and we're joined by our In Focus health correspondent, Linord Moudou, with more about a very serious disease. Hi, Linord, tell us more about this.
Hello, Dimiake. Well, it's about cancer. It is a generic term for a large group of diseases. The World Health Organization says that cancer is a leading cause of death worldwide, with the majority of victims residing in developing countries. In West Africa, patients and survivors in Ghana discuss the disease.
Agnes Donyo was diagnosed with cervical cancer last year. The 46-year-old now spends most of her time at home, a few kilometers outside Accra, Ghana's capital.
When I found that I had cancer, I had been running a small business and had saved up a little money. I ended up using it all for treatment, transportation, and school fees for my children. My husband doesn't have any job, so I'm the sole breadwinner. It's really messed up my family.
Agnes has not given up hope of a full recovery. 4 times a week, she goes for treatment at a nearby hospital. Her son Raymond has been worried about her.
The challenge was how I feel for her, because I found out a lot. I didn't know much about cancer, but when I heard that she has it, I researched a lot about it, and I found out that it was a very serious sickness, so I was affected. It kept me thinking all the time.
Cervical cancer can be caused by the human papilloma virus, or HPV. Every sexually active woman is at risk of contracting the virus. The World Health Organization says cervical cancer is a leading cause of cancer death among women in low-income countries. In Ghana, cervical cancer is the second most diagnosed form of cancer today.
Early detection of cancer would require screening programs, and such screening programs are usually organized by governments, and it becomes a policy of the Ministry of Health. So if you have something like cervical cancer, then you can institute early screening using pap smears or other modalities.
Cancer treatment is expensive. In Ghana, the cheapest chemotherapy regimen costs about $600, a fee most Ghanaians can't afford. And in cases where surgery is required, patients must go through expensive hormonal, radiation, or chemotherapy treatments afterwards. 64-year-old Torbi Chabi has prostate cancer.
My advice to others is that when they have problems, they should check it early. I blame my physician, because when I'm having the problem, I tell him I have the problem with my this. He was telling me because I was drinking. I said, Doc, how much do I drink? So later on, if I came to doctor, I'm blaming you because you are the cause. If you have told me I have this earlier on, I will have had it probably removed earlier.
Gladys Boateng found out she has breast cancer 11 years ago. After her diagnosis, she went to South Africa to have a mastectomy.
It was like a death sentence to me at that time, but it's not a death sentence now as I know. Before, I didn't know of any survivor. All the people I know were dead. That is because they go late presentation. So I thought I was going to die.
Gladys now wears a prosthetic bra, which costs about $40. She's the director of Reach for Recovery Ghana, a support group for cancer patients and survivors. The World Health Organization says deaths from cancer worldwide are projected to continue rising. The organization estimates 12 million deaths in 2030, with the majority in the developing world. Experts say that with careful attention to diet and lifestyle, and regular examinations for early signs of illness, many more Africans could avoid or survive the disease.